There is something happening inside your ear at this very moment that no standard medical test can detect. It is not an infection. It is not earwax buildup. It is not pressure. It is a slow, silent, and progressive destruction of the nerve that carries sound from your ear to your brain. And that ringing you hear, that constant hiss that seems to have no explanation, is the cry of that nerve begging for help. I know you have already been to the doctor. Probably more than once. You have likely had audiometry tests, CT scans, and blood work. And at some point, someone told you that everything was normal, that it was just stress, that you needed to learn to live with it. You walked out of that office with a prescription for an anti-anxiety med in your hand and a feeling that nobody truly understood what you were going through. This was not your fault. It was a failure of information, because what is happening to your auditory nerve is real, it is measurable, and most importantly, it is treatable. But the treatment does not start with surgery. It starts with a cleaning that you can begin today in your own home using strategies based on recent science that I am going to give you in this video. My name is Dr. Sarah Mitchell. I am a physician, and for over 15 years, I have been treating patients with chronic tinnitus. What I have learned in that time has taught me one thing. Most people suffering from ringing do not need more tests. They need more information. Stay with me until the end, because what you are going to discover today could completely change your relationship with that noise. But before we move on, tell me something. When your tinnitus gets worse, what usually happens right before? Were you feeling anxious? Did you eat something different? Did you have a bad night's sleep? Write it in the comments right now. This information helps me understand your case and helps others going through the same thing to identify their own patterns. Let's start with the truth that nobody told you. Think about a phone charger cable. That wire has a plastic coating around it, right? That protection exists for a very simple reason. Without it, the electrical current leaks. The signal arrives distorted. You get static, interference, and transmission failures. The wire inside isn't broken. The problem is the insulation. Your auditory nerve works exactly like that. Every nerve fiber that transmits sound from the ear to the brain is covered by a protective sheath called myelin. This sheath is like the plastic on the wire. When it is intact, the sound signal travels clean, fast, and perfect. When it is compromised, the signal leaks, distorts, and your brain receives noise where it should receive silence. The tinnitus you hear may literally be the electrical noise of an unprotected nerve. And here's what makes this urgent. This process of myelin sheath deterioration, which doctors call demyelination, is silent. It does not hurt. It does not show up on a standard ear exam. There is no obvious warning sign, except for one. The tinnitus itself. Most people hear this alarm and decide to ignore it. They take a painkiller, put on headphones, and just push through. Meanwhile, the cable keeps peeling. Now I need you to understand why this is happening to you specifically. Because the demyelination of the auditory nerve is not random. It has concrete causes, and the most common one, the one that shows up in at least 6 out of every 10 patients who come to my office with chronic tinnitus, is not aging. It is not genetics. It is a silent nutritional deficiency. Let me explain. The myelin sheath needs raw materials to exist. It does not maintain itself. Your body needs specific nutrients to build and repair this protective structure every single day in a continuous cycle. When these nutrients are missing, even at levels that appear normal on a basic blood test, the sheath begins to deteriorate. The main one is vitamin B12, not the B12 you know from a cheap multivitamin. I am talking about the active, bioavailable form that actually crosses the blood-brain barrier and reaches the auditory nerve. A study published in the American Journal of Otolaryngology followed over 100 military patients with chronic tinnitus after noise exposure. Nearly half of them had a B12 deficiency, and when the replacement was done correctly, using the active form of the nutrient, a significant portion reported a clear reduction in the intensity of the ringing. But B12 does not work alone. It needs partners. And this is where the second factor comes in, which very few people know about. The auditory nerve is one of the most vulnerable tissues to oxidative stress in the human body. Think of it like this. Every time your ear processes a sound, the nerve cells burn energy. In that process, they produce free radicals, which are unstable molecules that attack the myelin sheath like acid on plastic. Under normal conditions, the body has enough antioxidants to neutralize this attack before it causes damage. But with the modern diet, chronic stress, and aging, this defense system begins to fail. And when the free radicals win, the sheath cracks, the cable peels, and the static appears. Chronic inflammation of the auditory nerve is a process that can last for years before you notice any symptoms. By the time the tinnitus shows up, the damage has already been underway for a while. The good news is that the nerve has the capacity to repair itself. The myelin sheath can be rebuilt, but to do that, you need to stop feeding the process that is destroying it and start providing what the nerve needs to regenerate. What saddens me most as a doctor is not seeing patients with tinnitus. It is seeing patients who arrive after 5, 7, or 10 years of suffering because nobody ever explained that there was something concrete to do, that it wasn't just about learning to live with it, that the nerve was sending a signal that could be read and answered. Mr. Anderson was 69 years old when he came into my office. A former factory worker, he spent decades in loud environments. The ringing had started at 55, but he had normalized it. He thought it was just part of the job. Fate. When we ran the tests with the correct panel, including active B12 and inflammatory markers, the picture was clear. An auditory nerve in the process of demyelination due to chronic nutritional deficiency. We started the nerve cleaning protocol, and in 8 weeks he came back with a phrase I'll never forget. "Doctor, my granddaughter asked me why I've been smiling more. It wasn't because the ringing had vanished completely. It was because it was no longer in control of his life." So let's go deep into the science. Because the more you understand what is happening inside your auditory nerve, the more sense every step of the protocol I'm going to give you will make, and the harder it will be to ignore what your body is trying to tell you. Go back with me to that electrical cable. Imagine you have a high-voltage wire running through the wall of your house. On the outside, the wire looks perfect. The paint on the wall is intact. Nothing indicates what is happening inside. But inside the wall, at one specific point, the protective plastic is cracked. The current leaks at that spot. And every now and then, when the load increases, when it rains hard, when the voltage spikes, you hear static on your television, a noise that shouldn't be there. This is exactly what happens in your auditory system when the myelin sheath is compromised. The nerve isn't broken, it isn't dead. But at some point along the path between the ear and the brain, the insulation failed. And whenever the load increases, through stress, sleep deprivation, or dietary inflammation, the electrical leak increases. The static gets louder. And here is the detail that changes everything. The leak point can be repaired. Myelin reconstructs itself, but the body needs 3 simultaneous conditions to do this. Raw materials to manufacture a new sheath, an anti-inflammatory environment so the repair isn't destroyed while it's happening, and a reduction in the oxidative stress that cracks what was just rebuilt. Take any of those 3 elements out of the equation and the repair stops. The nerve keeps peeling, and the ringing continues. Let's start with the raw materials. The myelin sheath is composed mainly of specialized fat and protein. For the body to manufacture this fat, it needs two nutrients in adequate levels: vitamin B12 in the active form, which I already mentioned, and long-chain omega-3 fatty acids, specifically DHA. DHA is the structural building block of myelin. Without it, it's like trying to build a wall without bricks. You can have all the cement in the world, but there is no wall. A study published in the Journal of Nutritional Biochemistry demonstrated that DHA deficiency is directly associated with the thinning of the myelin sheath in nerve tissues. And the average American diet, with an excess of processed vegetable oils and low consumption of cold water fish, is chronically deficient in this nutrient. Practical sources of DHA you can include today: sardines and olive oil, natural tuna, salmon. If you don't consume fish regularly, high concentration omega-3 with at least 500 milligrams of DHA per capsule is a validated alternative. But always talk to your doctor before supplementing, especially if you use blood thinners. Now for the second element, the anti-inflammatory environment. The biggest enemy of myelin repair is not a lack of nutrients. It is active inflammation. Because when the nerve is in an inflammatory state, the immune system sends cells called macrophages to the area. Under normal conditions, these cells are cleaners. They arrive, remove debris, and leave. But when inflammation is chronic, the macrophages become overactivated and start attacking the very sheath the body is trying to rebuild. It's like hiring a renovation crew that tears down one wall while trying to put up another. The work never ends. The damage is perpetuated. And what maintains this chronic inflammatory state in the auditory nerve? Three main sources: excess refined sugar, which raises insulin and triggers inflammatory cytokines; chronic psychological stress, which keeps cortisol high and activates the same inflammatory process in the nervous system; and magnesium deficiency, which, besides being protective of auditory cells, is a potent modulator of neural inflammation. There is a compound that acts on all three fronts at the same time: curcumin, the active ingredient in turmeric. Researchers at the University of Edinburgh published data showing that curcumin specifically inhibits the inflammatory cytokines that attack the myelin sheath, while simultaneously stimulating the production of BDNF, which is the neural growth factor your auditory nerve needs to regenerate. The problem is that pure curcumin has very low absorption. It passes through the digestive tract without being utilized. The proven strategy to increase absorption is to combine it with piperine, the active component of black pepper. A pinch of black pepper on the plate where you use turmeric completely changes the bioavailability. It's that simple. Now we reach the third element: oxidative stress. This is where most protocols fail because people treat the symptoms without treating the source. Tell me something right now. Do you notice that your ringing gets worse during moments of high anxiety or tension? Write it in the comments, yes or no. Because if your answer is yes, that is not a coincidence. It is physiology. And the next step of the protocol was designed exactly for that. Subscribe to the channel so you don't miss the follow-up, because in the coming weeks, I'm going to bring more science like this straight to you. When the nervous system goes into alert mode, the adrenal cortex releases cortisol. Cortisol, in acute doses, is useful. It protects us and keeps us alert. But when it stays elevated chronically, as happens to anyone living with tinnitus for months or years, it produces an effect that neurologists call glucocorticoid neurotoxicity. In plain language, chronic stress literally burns neurons and deteriorates myelin sheaths. This is not a metaphor, it is a documented mechanism. And there is a strategy that very few people associate with tinnitus treatment, but that neuroscience data from the last 10 years has made impossible to ignore. the activation of the vagus nerve through controlled breathing. The vagus nerve is the largest nerve in the autonomic nervous system. When activated, it sends a direct signal to the brain. The threat has passed. You can leave war mode. Cortisol drops, neural inflammation reduces, and the window for myelin repair opens. The most studied and accessible technique to do this is called 4-7-8 breathing. You inhale through your nose for a count of 4 seconds. Hold your breath for a count of 7. Exhale through your mouth for a count of 8. 3 consecutive cycles, twice a day, preferably when you wake up and before you go to sleep. A clinical trial published in Frontiers in Psychiatry demonstrated that this breathing pattern significantly reduces salivary cortisol markers in just 4 weeks of consistent practice. For those with tinnitus associated with anxiety, this is not a meditation exercise. It is free pharmacology. Now I need to tell you about the signs. Because tinnitus rarely comes alone. And when it is accompanied by certain other sensations that most people don't even associate with the ear, the alarm needs to be louder. The first sign you cannot ignore is tingling, not necessarily in the ear. In your fingertips, in your feet, on your tongue. The auditory nerve and the peripheral nerves of the limbs share the same myelination process. When B12 is critically low, demyelination doesn't just happen in the auditory nerve. It happens throughout the entire nervous system at the same time. Tingling in the fingers along with ringing in the ear is the clinical signature of a deficiency that is attacking multiple nerves simultaneously. Mrs. Miller, 72 years old, arrived at my office complaining of bilateral tinnitus for 2 years. When I asked if she had other symptoms, she almost didn't mention the tingling in her hands. She said she thought it was just circulation, that it was just old age. When I ordered the full panel including active B12 and homocysteine, the results were alarming. Homocysteine, which is a marker of vascular and neural damage associated with B12 deficiency, was nearly 3 times above the safe limit. She didn't just have an ear problem. She had a silent process of neural deterioration that, without intervention, could compromise not only her hearing, but her cognitive function in the years to follow. The second sign is memory failure, along with the tinnitus. Forgetting names you know well. Losing your train of thought in the middle of a conversation. Taking a long time to find the right word. When these episodes appear alongside chronic ringing, it is not a coincidence, and it is not just your age. It is the same demyelination process affecting the cognitive nerves of the prefrontal cortex at the same time it wears down the auditory nerve. The third sign is tinnitus that changes in intensity after meals. If your ringing gets clearly louder after eating refined carbohydrates, white bread, pasta, or sweets, it indicates that the glycemic spike is triggering acute neural inflammation. Your auditory nerve is sensitive to blood sugar in a way that most doctors never mention during a consultation. And the fourth sign, the one that requires the most urgency, is pulsatile tinnitus. That is the one you feel in rhythm with your heartbeat, like a thumping inside the ear. This specific type of tinnitus is not a sign of nerve demyelination. It is a vascular sign. It can indicate uncontrolled high blood pressure, an anomaly in a blood vessel near the ear, or rarely, something that needs urgent imaging investigation. If your tinnitus pulses, see a doctor as a priority. This doesn't mean you have something serious. It means you need an investigation that this protocol does not replace. For all other types of tinnitus, the path of nerve cleaning exists. It is concrete, and it starts now. It is time to turn everything you have learned into concrete action, because information without a protocol is just anxiety with a scientific vocabulary. You didn't come here to leave more worried. You came to leave with a plan. I call this protocol the 4-layer nerve cleaning. Each layer attacks one of the mechanisms we discussed: the raw material deficiency, the active inflammation, the oxidative stress, and the cortisol that sabotages the repair while it tries to happen. You don't need to do everything at once, but each layer you add empowers the others. It is a compound effect that accelerates over time. Layer 1, rebuild the insulation. The nerve needs B12 in its active form, not the cyanocobalamin from the shelf multivitamin, which the liver needs to convert in multiple steps before it can be used. You need methylcobalamin, which arrives ready for use and crosses the blood-brain barrier to act directly on nerve tissue. Ask your doctor to test your serum B12, and if possible, homocysteine, which is the most sensitive marker of functional B12 deficiency, even when serum levels look normal. The richest food sources are sardines, eggs, beef liver, and natural tuna. If you eat these foods regularly, great. If not, talk to your doctor about methylcobalamin supplementation. The most studied dose for neural protection is 1,500 micrograms per day, but always with individualized guidance. Along with B12, you need DHA. At least 2 servings of cold water fish per week. If you prefer to supplement, look for capsules with at least 500 milligrams of DHA per dose, not total omega-3, but DHA specifically. This distinction makes all the difference in bioavailability for nerve tissue. Layer 2. Put out the inflammatory fire. Cut refined sugar from your dinner. Not from your whole life all at once, because radical change rarely lasts. Start with dinner, which is the meal closest to the nighttime repair period. The insulin spike at night suppresses the exact window in which the auditory nerve has the most capacity to reconstruct itself. Add turmeric with black pepper to at least 1 meal a day. A teaspoon of turmeric in scrambled eggs, a soup, or rice with a pinch of black pepper. It doesn't need to be a fancy recipe. It just needs daily consistency. And magnesium. Magnesium glycinate or threonate, taken at night, reduces the activity of inflammatory cytokines that attack myelin during sleep. Pumpkin seeds, cooked spinach, and almonds are the densest food sources. Include at least one of them in your dinner. Layer 3. Neutralize free radicals. Green tea is one of the most studied antioxidants for neural protection. It contains EGCG, a compound that crosses the blood-brain barrier and neutralizes free radicals directly in the nerve tissue. A study from the University of Tokyo demonstrated that regular green tea consumption is associated with a lower incidence of hearing decline in adults over 60. 1 to 2 cups a day without sugar, preferably in the morning or early afternoon. Not at night, because the caffeine interferes with the restorative sleep when nerve repair is most intense. And zinc, a mineral that participates directly in protecting the hair cells of the ear and the integrity of the myelin sheath. Zinc deficiency is common in adults over 60, especially those who use stomach medications like proton pump inhibitors, which reduce the absorption of this mineral. Natural sources: cashews, lean red meat, beans. With medical guidance, zinc chelate supplementation can be evaluated. Layer 4. Activate the vagus nerve and close the cortisol tap. This is the layer that people underestimate the most, and it is the one that most impacts the speed of repair, because as long as cortisol is high, the previous 3 layers are working against the current. You put in nutrients, the inflammation undoes them. You reduce inflammation, the stress oxidizes it again. The cycle doesn't break. The 4-7-8 breathing I described is your cortisol switch. 4 seconds of inhaling through the nose, 7 seconds of holding, 8 seconds of slow exhaling through the mouth. 3 cycles upon waking up, before any screens, any coffee, any news. 3 cycles before bed, after the lights are out. In 4 weeks of consistent practice, You will notice that the tinnitus worsens less during moments of tension, not because the sound changed, but because the nervous system learned to exit alarm mode faster. And when the alarm mode reduces, the noise of the nerve reduces with it. Complementing this layer is sleep, not just more hours, but repair quality sleep. Deep sleep, especially between midnight and 4 in the morning, is the period when the brain's glymphatic system clears metabolic waste from neural tissues, including the auditory nerve. Turn off screens an hour before bed. Use brown noise at a low volume if silence amplifies the ringing, and lie down with your head slightly elevated, about 15 degrees, to facilitate venous return from the inner ear. These 4 layers together are not a promise of immediate silence. They are a promise of direction. The nerve begins to receive what it needs to rebuild. The inflammation begins to subside. Cortisol finds an escape valve, and the tinnitus, which had the volume at maximum because the nerve was in despair, begins to retreat, slowly, consistently, with real progress. Mrs. Miller returned to my office 12 weeks after starting the full protocol. She brought her daughter with her. Her daughter said her mother had started participating in conversations at family meals again, that she had stopped asking people to repeat everything twice, that she was sleeping through the night without waking up in distress. Mrs. Miller said something that has stayed with me to this day. She said, "Doctor, I had forgotten what real silence feels like. Not the silence without noise, the silence without fear. That is what science applied with consistency can offer. Not a miracle, not instant silence, but the path back to a life that tinnitus no longer controls. Before I let you go, I need to reinforce the warning that every patient of mine hears in my office. If your tinnitus is pulsatile, if it appeared suddenly in only one ear, if it is accompanied by intense dizziness, a sudden drop in hearing, or difficulty swallowing, seek medical attention urgently. These are signs that require immediate investigation, and no nutrition protocol can replace that. For all other cases, what you learned today is the beginning of a more intelligent conversation with your own body. Let me give you a practical summary so you can start today. At breakfast, green tea without sugar and an egg with turmeric and black pepper. Throughout the week, 2 servings of sardines or tuna, cashews, and spinach. At dinner, 0 refined sugar and magnesium on your plate. 1 hour before bed, screens off. In bed, 4-7-8 breathing, 3 cycles, and brown noise at low volume. With medical guidance, request serum B12, homocysteine, and zinc in your next exams. Talk about methylcobalamin and high-concentration DHA if your levels are low. And share this video with someone you love who lives with this ringing without understanding what is happening. Send it to them and say, "Watch this until the end." Because sometimes the information that changes a life doesn't come from a doctor. It comes from someone who cared enough to share. In the next video, I am going to reveal something that almost no doctor mentions in the office. How certain common medications for blood pressure, pain, and acid reflux might be accelerating the very demyelination process we discussed today, without anyone warning you. Keep an eye on the channel so you don't miss it. I am Dr. Sarah Mitchell, and never forget, your auditory nerve is trying to communicate with you. Learn to listen to what it says before it has to scream louder. I wish you the silence you deserve. See you next time.